The following video is being used as part of a clinical research study. If you're not interested in participating in a clinical research study, you do not have to continue to watch this video. If you are interested in learning more about participating in a clinical research study, please continue to watch this video.
Thank you so much for your interest in participating in a clinical research study. You're probably wondering if this is the right decision for you. This video will help you understand more about clinical studies and how it can potentially benefit both you and your community.
What is a clinical research study?
Clinical research, also known as clinical studies or clinical trials, are the scientific testing of new procedures, therapies, or devices. The goal of clinical drug trial is to determine if an investigational drug or device is safe and if it works to improve the disease being treated. The reason that pharmaceutical companies and research institutions do clinical trials is to ultimately improve the quality of life of people with chronic diseases. A good clinical trial has participants of different age, gender, and racial backgrounds depending on the disease state being treated. It is through your participation in the clinical trials that we can assure that any new drug or device that is released for public use is safe and works in humans.
Why is it so important for African Americans to participate in clinical trials? African Americans develop serious illnesses such as hypertension, prostate cancer, diabetes, and AIDS much more often than do other Americans. We suffer more complications and in some instances die earlier from many of these same conditions and diseases. We need to find ways to reduce or eliminate these high rates in our communities. Clinical trials may be part of the answer. Due to lack of participation in clinical trials over the years, very little is known about how African Americans respond to various treatments. We know that African Americans metabolize some drugs differently than Caucasians, and that some drugs may require higher doses to get the same effect. We also know that there are certain medications that cause different side effects in African Americans than seen in Caucasians. Why do African Americans not participate in clinical trials?
There are a number of reasons given why African Americans do not participate in clinical trials. And those reasons include lack of awareness. People simply don't know about them. Or they have no access to health care, to the places where these clinical trials are being done. In those cases where people do have access, they often say the doctor didn't recommend participation. Or there is a fear or a mistrust of the whole system of clinical research in their medical care. There are a number of cultural beliefs and myths concerning the use of minority patients as guinea pigs or as preferred experimental subjects. And of course, this derives from racial and ethnic discrimination that's been the case in past instances of clinical research. Many people often hearken back to the old Tuskegee or so-called Tuskegee experiment.
What is the relationship between diabetes and heart disease?
It turns out that people with diabetes have a higher than average risk of having a heart attack or a stroke. In fact, 3 to 4 times higher for heart attacks and up to 6 times higher for stroke. These conditions strike people with diabetes very often, more than twice the rate that people are struck who don't have diabetes. There's a huge link between diabetes, heart disease, and stroke. In fact, when one looks at the statistics, more than 2 of 3 people with diabetes die from these conditions, overall considered cardiovascular disease. The presence of diabetes means that there's accelerated atherosclerosis, or clogging of the arteries. Fortunately, there are treatments for heart disease, stroke, and blood vessel disease like atherosclerosis. People with type 2 diabetes also have much higher rates of high blood pressure. They have higher levels of lipid problems, blood pressure, cholesterol, triglycerides, and they have a much greater likelihood of obesity, all of which contribute to their high rates of cardiovascular disease. And it must be remembered that smoking doubles the risk of cardiovascular disease in people with diabetes.
What is ACS, or acute coronary syndrome?
When the blood supply to the heart is blocked by a blood clot or a piece of plaque, you will experience chest pain. Acute coronary syndrome is a cluster of conditions that include angina and/or heart attack. Angina is chest pain or discomfort that occurs if an area of the heart muscle doesn't get enough oxygen-rich blood. Angina may feel like a pressure is squeezing in your chest. The pain can also occur in your shoulders, your arms, your neck, jaw, or back. Angina pain may even feel like indigestion. Angina isn't a disease, it's a symptom of an underlying heart problem. Heart attack is a medical emergency and should be taken very seriously. During a heart attack, the parts of the heart muscle dies due to lack of oxygen. The dying of the heart tissue is what causes the pain. What are the symptoms of acute coronary syndrome or ACS? Chest pain or discomfort may immediately signal to you that something's wrong with your heart. Other symptoms, however, may leave you unsure of what's wrong. Take note of these common signs of acute coronary syndrome. There is chest pain or discomfort, which may involve pressure, tightness, or fullness. Pain or discomfort in one or both arms, the jaw, neck, back, or stomach. Shortness of breath, feeling dizzy or lightheaded, nausea, sweating. If you are having a heart attack, you should call 911 and get to the hospital immediately.
What questions should you ask before participating in a clinical trial? Remember that participating in a clinical trial will require a commitment of time and a willingness to complete the trial. Note: your participation in a clinical research study is voluntary, and you can leave the study at any time for any reason. Questions to ask: what type of clinical trial is this, and what is the goal of the study? What types of patients are being enrolled in the study? How will I know if I'm getting the study drug or the inactive placebo? What will I have to do to fully participate in the study? How long will the study last? Will my insurance cover all of my tests, hospitalization, office visits, and medication? Will I receive compensation for my time, travel, or childcare expenses? What are the potential side effects of the study drug? If the treatment works, can I remain on the drug after the study is over? How will I know if the study drug is not working? Can I change my mind and withdraw from the study without any problems? What is the Elixa study?
The word ELIXA, E-L-I-X-A, stands for Evaluation of Lixisenatide in Acute Coronary Syndrome. This is a 10 to 47 month cardiovascular diabetes study designed to evaluate the effectiveness of a new investigational injectable drug, lixisenatide, that is administered once daily. The study seeks to determine if lixisenatide can prevent heart attacks by lowering the blood sugar in patients with type 2 diabetes. ELIXA is a global study being conducted in 45 countries. There will be 1,000 sites worldwide and over 6,000 study participants.
What type of patient will be included in the study?
First, the patient has to have type 2 diabetes. In addition to that, they have to satisfy several other requirements. There must be a man or a woman more than 30 years of age who came into the hospital with chest pain. The patient may have an abnormal EKG reflecting the fact that they had a heart attack, also known as myocardial infarction. If the patient meets the requirements for the trial, they will be contacted by a doctor to see if they're interested in enrolling in the study. That doctor may be your own primary care doctor. It may be an endocrinologist, a cardiologist, or it may be a doctor who works in the hospital. At that time, the study will be reviewed with you and all of your questions will be answered. If you decide to participate in the trial, then you will be asked to sign an informed consent form.
What is informed consent?
Informed consent is a process that makes sure that every volunteer for a clinical study is told everything he or she needs to know in order to make a good and independent judgment about whether to join a trial. Informed consent has two parts. First, being informed, then maybe giving consent. Being informed means that the physician investigator must tell you everything you need to know to make a good decision about whether or not to join a trial. The investigator must tell you about the purpose of the trial and what they expect to happen. This includes all of the risks and the benefits of joining the study. Giving your consent means that you have agreed in writing to join a clinical trial of your own free will. It is against the law for anyone to pressure you or to force you in any way to join a clinical study. For the Elixa trial, the informed consent process may happen when you are in the hospital, or it may happen at your first screening visit with the investigator who will be following you for the duration of the study.
After leaving the hospital, what will happen next?
After leaving the hospital or emergency room, you will be contacted by a Healing Our Village educator or a study coordinator to provide more information about the study. Healing Our Village educators are pharmacists, diabetes educators, or wellness coaches. They are there to answer your questions about your diabetes and to schedule you for your first screening visit with the investigator.
How will the Elixa study work?
At the screening visit, which is visit 1, the investigator will review the informed consent form, making sure that all of your questions are answered. You will receive a full examination and blood work will be done to make sure you are eligible to participate in the study. If you qualify to be in the study, you will be taken off of any drugs that you are on in the same class as the study drug. You will be able to continue all of the rest of your diabetes medications. You will be given a pen injection device and you will be trained on its use. You will self-inject the placebo, which is an inactive look-alike substance, during visit 1 in order to practice.
You should discuss with the study doctor any questions that you have about being taken off any of your medications. You should come to your screening visit, visit 1, prepared to discuss all of your medication questions.
Between visit 1 and visit 2, you will be asked to self-inject the placebo every morning and eat breakfast within 1 hour of self-injecting to show that you are comfortable with using the pen injection device, which we call the pen, and that you are willing and able to use the pen until the end of the clinical study. In approximately 1 week, you will return for visit 2, which is the randomization visit. If you continue to qualify for the study at this visit, you will be randomly assigned by chance, like flipping a coin, to lixisenatide, which is the active drug, or placebo, which is the inactive look-alike substance. You have a 50-50 chance of getting lixisenatide or placebo. The study is double-blind, which means that neither you nor your doctor will know which study drug you are on. You will start your treatment at visit 2, and you will participate for approximately 10 to 47 months, depending on when you start the study.
Remember, even though the study is double-blind, in an emergency, the study doctor will be able to find out what study drug you are receiving. What are the advantages of participating in the Elixa study?
So let's consider some of the advantages of participation in the Elixa study. The Elixa study itself is an example of a well-designed and well-executed clinical trial that provides the best approach for participants to first be seen regularly and receive careful medical attention from a committed research team that includes doctors and other healthcare professionals. And then finally, and most importantly, this provides an opportunity for participants to help others by contributing to medical research questions in diabetes.
Additional advantages of participating in the Elixa study.
So there are other concrete advantages of participating in the Elixa study. Qualified participants will receive study medications. They will receive diabetes testing materials and equipment. They will receive study-related medical exams throughout the course of the study.
Disadvantages of participating in the Elixa study.
Just as there are advantages, there are often disadvantages in any clinical trial. As with any medication, the study drug has potential for risks, side effects, and discomforts. Lixazinotide has generally been well tolerated in healthy subjects and subjects with diabetes. The most common side effects that have been encountered with this drug include headache, nausea, some vomiting, diarrhea, dizziness, constipation, and occasional flatulence or gas. Now, if any possible side effects and discomforts actually arise during the course of the study, one should immediately contact the doctor who's overseeing the study. The other disadvantage that most people will encounter is the fact that you have to come to your doctor a great deal more frequently than you normally do, particularly at the beginning of the study. This will take more of your time. The good news is that you will be paid for your time as well as your travel costs.
Thank you for your interest in clinical trials.